Cox Flexion-Distraction therapy is a specialized hands-on treatment method to deal with spinal pain and dysfunction. In recent decades, Cox therapy has emerged as one of the safest, most effective, and most widely researched treatment methods for a number of lower back and neck conditions. In this brief video, we'll take a look at what Cox Flexion-Distraction therapy is and how it's so effective in dealing with neck pain. When we look at the basic anatomy of the cervical spine, we can see that it consists essentially of a series of block-like bones stacked on top of each other. Each of these bones is connected to each other through a series of soft tissues in order to form a joint in between each of these bones. Now, under normal circumstances, these joints should allow each of these spinal bones of the neck to bend, twist, and move on each other. And that's very important in order to maintain normal function and mobility of the cervical spine. However, it's common for the soft tissues around these spinal joints to become tight and restricted. And when this happens, it can start to affect and limit the normal mobility of one or more of these spinal joints. Now, not only can this lead to symptoms such as pain and stiffness, but because it starts to affect the mechanical nature and the movement capacity of the neck itself, it can start to create some excessive wear and tear on the joints of the spine. And over time, this can lead to damage and degradation of some of the cartilage and soft tissue structures, and eventually it can lead to pain and inflammation. Now, this abnormal mobility and mechanical changes in through the neck is a common theme throughout a number of common neck conditions, including neck conditions that would affect, for example, the intervertebral disc, such as a strain or herniation. It would be a component of degenerative conditions such as arthritis or spinal degenerative disc disease. And it's certainly a major component of what we refer to as mechanical neck pain. And because of the prominence and the importance of neck dysfunction, and in particular joint dysfunction within the neck, it is very important that we have a proven and a safe and a comfortable but also a very effective method in order to treat some of these joint restrictions and restore proper mobility to the joints of the spine. And this is really where Cox Flexion-Distraction shines. So let's take a look at what Cox Flexion-Distraction is and how it goes about restoring some of these neck restrictions. As previously stated, Cox Flexion-Distraction therapy is a specialized hands-on treatment method for treating neck pain. And Cox Flexion-Distraction actually uses a specially engineered table in order to gently stretch out the joints of the spine. So let's take a look at how this works. Essentially, when we're performing treatment, we would have the patient lying face down on the table such that their face would be resting on this headpiece. This headpiece can actually then be unlocked and gently and slowly moved around by the practitioner. So for example, we would be able to unlock the headpiece, and it would be able to form an up and down or flexion extension motion. We would be able to unlock the table and perform a lateral flexion or a lateral bending moment. And we're also able to unlock the table in such a way to create a distraction or traction motion on the spine. And essentially how this works is that with the patient lying on the table, their head is essentially attached, or it's consistent with this headpiece. So as the headpiece moves, it actually exerts a gentle stretch onto the structures of the neck. So let's take a look at how this looks when we're actually treating a real patient. So as discussed, we're going to start with the patient lying face down on the table, and their head is going to be resting on the headpiece. Then we're going to unlock the headpiece so that we can begin treatment. Now, before I'm actually going to move the headpiece around and stretch the neck, I'm also going to take a soft contact with my hand at the level of the neck that we found to be restricted. So essentially what I'm doing is just providing a little bit of a tension, a little bit of a pressure on the lower bone of that joint in order to try to stabilize it. And I'm going to hold that tension while I'm moving the headpiece and therefore the neck into flexion and extension and or into these lateral bending motions. So essentially what we're doing here is we're trying to stabilize the lower bone with our contact. The headpiece is then moving around to exert a motion into flexion, extension, and lateral bending onto the upper part of the bone. And that way we're able to get very specific at where we're applying the treatment. The other effect that we're able to do with this table, as we mentioned, is we're able to exert a traction effect from the headpiece. And what this actually does is, as we're providing treatment, it actually gently pulls the two bones apart. And this can be very effective with conditions involving the intervertebral disc, like a herniation or a strain, because it reduces the pressure within the disc and helping it to heal up. And also in conditions that we have a radicular symptom, such as pain going down the arm, again with a disc herniation, or perhaps with a degenerative condition like a spinal stenosis. As these joints are able to be separated a little bit with that traction, it creates some space in between the joints, which is where the nerve lives. And as we increase some of that space, it takes some of the pressure and compression off of that nerve, which helps with alleviating pain and also promoting healing within the nerve itself. So as we would be providing treatment here, what we would do is we would typically hold each of these stretches for 4 or 5 seconds. And we'd repeat that maybe 4 or 5 times. And as we're doing this, we're actually able to modify the amount of tension we're using, both with the contact that I have with my hand on the patient's neck, as well as the depth and the amount of stretch we're using with the table. And that way we're able to make sure that the tolerance to the treatment matches the level of pain and the condition that's going on. So obviously for a little bit of a more acute neck, for example a radiculopathy or a disc problem, we would be able to be a little bit gentler to make it a little bit more tolerable for the patient while they're in that acute state. Likewise, if it's more of a mechanical neck pain and the tolerance is a little bit higher, we can provide a little bit more stretch to get a little bit of a deeper treatment and provide a better release for the joints and the soft tissues around the neck.